since I met you, girl, I've had a change to be the kind of man that you wanna take. So I'm coming back for you. It doesn't matter where I go, I'm already yours. Everybody else, I don't wanna know. It all comes down to you. Having all the times around you, I got me feeling like starting my new life now.
Okay, so that was Baby Cool's Love You Every Day. And as some of you might know, Baby Cool is a great TV champion. But can I just make sure everyone can hear me? Can someone say yes? No?
Yes.
Yes.
Oh, perfect. Okay, so let's get the show on the road since we only have an hour with each other. Thanks to everyone for joining the Stopty Partnership's first Innovation Spotlight of the new year. In case you don't know me, my name is Jackie Ha, and I'm head of the External Affairs and Strategic Initiatives team. Before we dive into our event, I want to warn you that you're kind of serving as our guinea pig today, in that we're going to try something different and have structured this program to be more like a Clubhouse, which is this new social media platform that has somehow erupted in the past year, like discussion, or maybe a better way to describe it, an informal, lively, and real conversation that we would have over a cup of coffee with a group of friends. So I know that, next slide, please, Janina. Perfect, thank you. So I know that when you're having coffee with your friends, you don't develop an agenda, or maybe some of you do, but I thought it would be nice for you to see all the fabulous women innovators in TB who've joined us today. With that said, and I apologize in advance that I'm going to sound like my Korean mother, lecturing her, of course, brilliant Korean daughter, even though I think she would like to say to me that if I didn't take too many naps, I would even be more accomplished than I am already. But there's a few housekeeping matters that I'd like to quickly go over. The Virtual Innovation Spotlight is being recorded and will be made available on the Stopty Partnership's website in the coming weeks. During the coffee talk discussion, except for our fabulous women innovators, please keep yourself muted. During the Q&A session, please use your raise hand function to request the floor. And last but not least, before you ask your question, please introduce yourself so that we can all become friends. So now, I'd like to give the floor to Luchika, the Executive Director of the Stopty Partnership, for some inspirational words of welcome. So Luchika, please inspire us.
Well, I don't think I can inspire you, but I think what is nice is this idea of a coffee together. And I am very happy because it's a ugly day here in Geneva. Winter looks like it's coming back. Winter is coming, not spring. But I feel the warmth of seeing so many ladies and so many amazing people that I actually like or admire very much myself. So it's really funny. But if we think that we are in a coffee shop, the first thing, you know, is like I sit at the table. That's what I always do. And I will go for like, is anyone that wants to have a cake? Can we share? And I think I'll have an espresso and the sparkling water, please. So this is my contribution. No, so I think the more we are entering into this virtual phase, you know, in which a lot of our discussions are over a screen. And I was thinking that for my mother who comes from a village, if she will see what I do all day, and maybe some of you do, because here in Geneva, we cannot go to work all day. I sit at a table speaking alone in front of a computer. And it's like, you know, for someone, if goes in and sees you there hour after hour, is sometimes very difficult to realize the impact that this speaking in front of a computer hopefully will have or will help some people that will benefit from some of these discussions and so on. And I'm referring here to the ones that we all try to serve, people that are sick or people that are in need of care, let's put it this way, for TB, but also for anything else and any other disease. Because what I think this seminar is about, and I know some of you here, I saw is Olive, Maureen, Kilona, Karin, all of us, is not just about people with TB, and is about people suffering or in need of care of something. And we in Stop TB Partnership, even though we are very the ones that are taking the flag for fighting for people with TB, we also want to really embrace the fact that disease is one, but we look at people. And one of the things that we keep close to our hearts is about the people that we try to serve and we try to help, and is not about a disease. So reinventing care is actually something that we spoke for many years in Stop TB, in different formats, without reimagining, reinventing, around this terminology, reimagining after some time. And it came from the fact that for any of us, it's always a burden to go to seek healthcare. I joined Geneva. I don't feel that I am Swiss or Genevoise. I still feel I'm Romanian. As Romanian, we needed visa. As Romanian, we have a certain name here in Switzerland. Unfortunately, a lot of Romanians, unfortunately, are not really best friends of police. So every time I approach an official system in Romania or I go somewhere, when I say I'm Romanian, actually people are like putting their glasses and look above them at me. But it's not about that. And that's why I say that seeking care for a lot of people is a burden. What can we do to decrease that burden, to delete that barrier? It can be anything. It can be this, what I said. It can be money. It can be distance. It can be having kids at home or no job. It can be distance. It can be shame. It can be you don't have the right clothes. You don't have the right papers. You don't have the right income. So we should do whatever it takes, and it's not about TB, to bring the care closer to people and delete that thing that is in between. And thinking from that perspective, COVID also learned us that the closer we are with the people affected, the better and easier will be for TB the same. Because if you have a service that is here in my neighborhood, which is a sort of red district for Geneva, I tell you that for sure people will approach much easier than if we have to go and seek over the bridge in the other parts of the city care. So reimagining TB care is really what can we do to decrease this barrier, and what tools do we have, knowing that it's 2021, we go to 2022. So we might have some opportunities, tools, thinking, even money that we didn't think of several years ago. And it's amazing to have an amazing group of people that I know you guys have a huge heart for people with TB, as I said, people with TB, but also people with HIV, people with any disease. I'm looking here of the people attending, and I see a large number of ladies, and we are, as women, are always more nurturing and more caring. And I would like to say, I don't want to make a big debate now on gender and stuff, but I want to say that there is this feeling that we try to embrace more people that are suffering, whatever suffering means, and we try to help. So this is the entire idea. It is not about inspiration, because some of the things that you guys do are the ones that are inspiring us. And I know some of the things you do implement in your life or as work is what inspire all of us. And, sitting in Geneva in my living room here, I'm not doing many inspirational things, but I feel very strong about the fact that if we are in this position now, we should do whatever it takes to push the agenda in which the care is provided closer, easier, effective, equitable to everyone. And if we are smart in putting these things together, we will deliver. Thank you, Jackie, so much. And I'm going to stay a while here because I really like this company. So let's see how it goes, this coffee shop. Thank you.
No, and Lucica, I think you raised a really important point. I choose services, even dry cleaning, grocery shops, whatever, based on ease and convenience. And that is the same type of philosophy that should apply for the people we are here to serve. And so there should not be this dichotomy between, oh, Jackie and Luchika, like they care about ease and convenience about X, Y, and Z. Well, you know what? Yeah, it's true. But you know, this is the same expectations we should have for even like the TV affected communities and people. So I think that was really inspirational in that there should not be multiple tiered levels of expectations, ease or convenience, depending on where you live or whatnot. Everyone, regardless of who you are, where you live, should have that same kind of convenience and ease. So with that said, you know, I'm beyond excited to be co-hosting today's Virtual Innovation Spotlight with Olive Mumba. So perfect, thank you so much, Janita. The technical advisor at TV Women and the former executive director of INASO. You know, Olive just blew my mind away when we held our third reimagining TV care consultation in Hyderabad, which seems like a lifetime ago. And what impressed me so much about Olive was that she was this like amazing, enthusiastic participant in our various human-centered design activities and shenanigans. So Olive, can you tell us why we should all be excited to be here today? Because you can tell I'm pretty excited, so we should all be excited. Particularly during the week of International Women's Day and the launch of the TV Women Network. So Olive, please, the floor is yours.
Thank you so much, Jackie. And thanks, Luchika and the team that is here. It's really interesting and really nice. As you can see, the sun is out. So probably I'm going to choose something that is cool so that I can feel a bit more relaxed. I'm just wanting to say, for me, innovation is quite important. And we cannot continue doing the same things and expect different results. So with the launching of the TV Women Network, we want to see more opportunities and space opening up for women in the TB response. So for us, innovation means everything in this fast growing world. We cannot continue to remain behind and doing the same things over and over again. We also should have noted that COVID-19 has shown us how fast solutions can be developed and scaled up. And especially when we looked at how to get people into screening, how people get information, how people can get treatment, you know, there was a need for a very fast movement. And technology was everything. Any place where you go, like in the supermarkets, you have a temperature scanner, you have these sanitizer dispensers, all of that is technology. So with TB, if we are to get all the people missing with TB, it means that, especially women, to be in the forefront, it means that as women, we need to be part of the conversation of technology, also being in the forefront of identifying what are the technologies that will help us to respond in an equitable manner. We also know that with human rights and gender considerations, it's very important that we be part of the conversation. If we are not, we most likely will see that communities are being left out. And if communities are being left out, we see that those discussions.
Maureen, do you mind muting yourself? Thank you.
Thank you so much. I think I was muted by mistake as well. So I just wanted to reiterate the point on the importance of human rights and gender considerations, especially when it comes to technology, that yes, developers will always come up with issues, come up with new technology, but if we are involved, if we are engaged, then we'll be able to especially know whether the technology considers human rights, the rights of the individual, especially people with TB, or if it doesn't, then also consider how and provide those solutions on how to make it more human rights and gender friendly. international, we've also been seeing that the International Women's Day, the theme was choose to challenge. So we know if you challenge, it means that you have to be at par. You have to be even above, the innovation that is there. So as women, we should not accept to be left behind, but we should challenge ourselves to understand the innovations, but also come up with innovative solutions for ourselves. And as most of us are also caregivers, how to better provide treatment adherence, how to better get information to the communities, how better to create awareness. And lastly, therefore, it is an honor and a privilege to be a woman innovator, a woman from the community of TB affected community, a woman who understands human rights and gender equality, and at the same time being an innovator. So I'm really humbled and honored to be part of this. Thank you so much. Back to you, Jackie.
Thank you, Olive. And whoever is unmuted, can you please mute yourself? Maureen? Oh, perfect. So, I think Olive, you raised a really great point, because I even sorry, I'm going to introduce my personal life history here and my professional one. But, I think about who has had the most impact on me personally and professionally. And it has always been women. Even though, we fight and, all of that great stuff. Like, I think, when I think about my life, I see my grandmother who escaped North Korea and then dabbled in the black market in South Korea and went to jail. But that's another whole story I can tell all of you later. I think of my mom. I think of Luchika, and I think of all of you, like Olive and Kelly, I think, who's on this call, and Reshma, and others who really were so just impactful in my life, both personally and professionally. So not to diminish the value of men, because my husband is obviously very clearly important, but I thought that was really important. So okay, moving on. So this is probably going to be the most boring part of our virtual innovation spotlight. And we plan on organizing a 4th Reimagining TB Care consultation later this year to dive into the nitty-gritty details of the initiative. However, I'm just going to briefly go over a few points just to set the scene for a coffee talk discussion. Reimagining TB Care's vision is to transform when, where, and how affordable, quality, and people-centered TB care is provided and access in TB-affected countries. We believe one way, it's just one way to do this, is by leveraging digital health technologies that are not only available today, but are being developed for tomorrow, and ensuring their optimal rollout, equitable access, and appropriate use. The 2 guiding principles that I want to highlight is, first, Reimagine TB Care has been developed by, with multiple partners, and by listening to and in partnership with national TB programs, implementing partners, civil society and communities, and innovators, particularly through all their participation in our various consultations and multiple one-on-one discussions over a couple of years. Second, the initiative is about making it, as Luchika and Olive and myself have just mentioned, it's about making it as convenient and easy as possible for providers to provide TB services, and for TB-affected people to access these services, specifically by looking at how to bring them as close as possible to where they live, where they work, where they congregate, where they shop, etc. I think COVID-19 has even shown us, and I might be opening myself up to being attacked here, is that even point of care seems a little bit archaic now, but that's maybe for another VIS discussion. The 3 key pillars of Reimagining TB Care and the basis for today's coffee talk discussion are to, 1, source, assess, and prioritize promising digital health technologies. 2, accelerate the rollout of these prioritized digital health technologies, and 3, catalyze and demonstrate an open source national interconnected care platform, which brings together these prioritized digital health technologies in a way and to ensure that they're integrated and interoperable. So I'm going to stop here because I want to move on to the first fun part of the virtual innovation spotlight. But I'm well aware that many of you might have a lot of questions, and I'm happy to have one-on-one discussions with all of you. But again, as I said, you know, in the coming months, we do plan on organizing a 4th Reimagine TB Care consultation where we will get into the nitty-gritty of what this initiative is. So, and the first part, you know, fun first part starts with a just a minute challenge for everyone. And that means like everyone who's on this call. What does people-centered care means to you? If you could write your answer down in the chat box in 1 minute, that'd be great. Don't be shy. Please write something down. No judgment. You know, it's a safe space. No one's writing anything down, really? Oh my gosh. Okay, Lonnie, fantastic. Care is convenient and appropriate to my needs. Luchika, one person, okay. Kelly, meeting the patient. Okay, now there's too much. I can't even like, so I want you to please read the chat box because I think this is really important for us to really understand what people-centered care means, because I think we use this phrase almost too loosely, but I think this is really fantastic that we see what people think, and it's again a safe space, no judgment. Okay, fantastic, fantastic. Okay, so we're gonna park this for now because I'm gonna probably come back to this during our Q&A session. But Marie, you're on.
Yes.
Oh, perfect. Okay, yes. Okay, fantastic. So you're the first one in the hot seat. Yeah, I know. You get a fan or something, or drink like iced tea. As the executive director of the Lean On Me Foundation, and as one of the founders of the TB Network, I feel like you have a frontline, on the ground perspective on how the TB community at large can shift from one size fits all model to a more people-centered care one. Can you give us your thoughts on this? Not just about just shifting our mindset, but what are the tangible ways we can make this happen? Marie, hello?
I'm unmuting myself, sorry, it took a while.
Sorry.
Yeah, so being in this response for a while, looking at the TB response, looking from the time we were focusing on dots and trying to fight that direct observation treatment and stuff like that, I think one size fits all doesn't really work in TB, like it doesn't work in other epidemics such as HIV, because we have different TB needs. For example, initially, when you had TB, you would go to a hospital and the algorithm will show that they'll do an X-ray. And then after an X-ray, you go, if the results show that you have TB, or if they don't show, you go for sputum. And we missed a lot of people who had, now I'm talking about diagnosis. We missed a lot of people who had extrapulmonary TB. Nobody took time to, first of all, talk to the patient and ask, how are you feeling? What are the symptoms? Do you have any other underlying condition? You know, those things that would have led us to a quick diagnosis of this person. So we ended up losing people because we had an algorithm that had been written by Ministry of Health that was being followed like a Bible. And then secondly, we have in recent times seen that those who have TB and are able to take care of like basic things like nutritional needs have better health outcomes than those who are poor. So it is important that we take into consideration other social drivers of the TB epidemic. So for me, in a nutshell, I'm saying we need differentiated TB care models so that we know that we first of all assess the client or the patient. I don't like calling people patients, but okay, with TB, it's a sickness and therefore it's a patient. But we first assess the person who walks into the health facility, find out their needs, both socially, physically, and ask them, give them the different options for care and ask them to choose from the different options, because we have seen different options being piloted. We have even seen some of the virtual, there's one of this conference, I saw that they were doing videos with doctors and they were able to see their doctor without really traveling miles away to go and talk to their doctors and see how they feel. So I think these are some of the innovative things that we need to think of, but ideally for us to have a people-centered approach to TB care, we need to look at the client. It has to be client-centered, like we said, or patient-centered, so that we understand what we need. The other day, we almost lost a young girl of 17 years because she had TB of the breast. It was my first time to hear about TB of the breast. And so when they couldn't think of it as breast cancer, they thought she just had an infection. Until she was almost dead, that's when they realized that it was actually TB of the breast. So if we had a differentiated, more responsive or more targeted attention to this person, we wouldn't have reached to a place where we are almost losing her. Thank you.
So, Maureen, I think you raised a really interesting question for, you raised an interesting question. So, you know, one thing I have wondered about is the way TB affected people, you know, with everything they have to deal with, is how are they making their decisions, right? Because the TB affected people, there's a lot they have to think about, consider, and so it would be really great to hear from you, like, you know, when a TB affected person gets sick with TB particularly, like what is the decision-making process that's going through their mind? Because I almost feel like, and I could be wrong, that, you know, there's many things they need to consider and they may potentially be deprioritizing their own health for the consideration of their family, supporting their family, stigma, etc. So it would be great to hear your thoughts on that.
Okay, so when someone is diagnosed with TB, if I walked into the health facility and they took samples and they told me I have TB, in my part of the world, the first question is, am I HIV positive? Because there's a lot of linkage of TB to HIV. So the HIV is still regarded as a disease of the promiscuous. So the first question is, am I HIV positive? Will the society regard me as a promiscuous person? Will my partner or my spouse leave me because I have TB? Because the moment you are diagnosed with TB, your partner thinks you have HIV as well. You've been promiscuous, you've not been honest in the relationship, and therefore they walk away. The second thing that comes into your mind, will I need to be isolated? I am the breadwinner of my family. I need to work every day because I'm paid daily wages to feed my children. Should they isolate me? How will my children survive? The third thing that comes to your mind is, when they isolate me and people know I have TB, they'll have to stay away from me to prevent infection. When will they accept me back? Because that period of isolation becomes very lonely. And when you want to integrate back to the community, they still think you are infectious. They still don't disengage you from TB, even when you're fully cured. So you're like, if I am to go back to my job or to go back to my social cycles, will they accept me? Will they agree to come and visit me? Should I be admitted in hospital? Will I get visitors, or everyone will fear coming near me because I have TB? And finally, if it is your child, you know, as women, we have children. And at one point, my son had TB. Now, how will I integrate him back to school? Will he even have a desk mate, or will he sit alone for the rest of his education life? So these are some of the things that quickly come to your mind when you are diagnosed with TB.
No, and I think, you know, I feel like we could have a whole conversation about this. There's so many things that you just said I want to unpack, and like, oh, you know, like, yeah. I mean, so I think we need to have a separate conversation about this and unpack some of the things you just said, because I think unless we address some of the things you mentioned, you know what, like, we can develop as many shiny new tools we want, but those tools are not going to address what you just said. So I think I'm going to park this for now to move on to the next question. But I think what you have said, Maureen, hopefully everyone on this call can keep that in the back of their mind as, you know, we not only think about and evaluate, demonstrate, introduce and roll out new technologies, because unless you address those issues that Maureen just brought up, like, we're just not going to end TB by 2030. So Maureen, thank you so much. And we'll come back to you for sure during our Q&A session, but maybe for now, I'll move on to Donna. So you're here today representing the National TB Program of Philippines, and I hear you're the ICT guru for the program, which is fantastic. You know, so Donna, Selena and I have had multiple discussions across many years, and we've also, I think, eaten a lot of dried pineapple strips for some reason, but about how countries are getting inundated and quite frankly overwhelmed by the numerous solutions, particularly digital health technologies that are available and being developed. Can you tell us how Philippines prioritizes solutions, particularly digital health technologies, and how you determine what fits for your context and setting?
Yes. So in the recent years, even before COVID-19, we have been receiving several proposals for testing both TB-specific and even non-TB specific digital health technologies. We would be receiving calls and emails inviting us to hear presentations of products. So because of that, we convened a group, sub-technical working group from the main TWG to help the program prioritize. The group came up with several suggestions on what to consider when there are new DHTs being proposed to be used by the program. But the major ones are first, the alignment with the National Strategic Plan. Then second, cost and sustainability. And third, compliance to the Ministry or Department of Health standards. Which also includes interoperability with the NTP's information system. So for the alignment with the NSP, since the drafting of our second strategic plan, the 2017 to 2022 NSP, we ensure that in the plan we include milestone digital transformations that we want to do. We plotted priority activities, which processes to automate, which information systems we will target to integrate with, and which problems to solve when and in which year. And then as the years passed, we saw that there are several tools that are coming in. So last year, we decided to start drafting an ICT roadmap. So this roadmap is a sub-plan of our main NSP. And the roadmap aims to enable synergy and alignment of ICT initiatives within a timeline that we hope to lead to increased efficiency, scalability, and sustainability. As for the consideration on cost, as you know, governments have limited budget, so we want to ensure optimal use of resources. In our country, we also are employing a new evaluation mechanism, which is called the health technology assessment. This process aims to evaluate the economic issues of a health intervention. This new assessment is also helpful for the program because the people doing this is external to NTP. So we ensure that by undergoing HTA, we make sure that other than the program, there are external assessors if the technology is really helpful, not just for TB, but also for other health programs. And lastly, the last among the major considerations is compliance to DOH standards. So we always make sure that the technology is or solution is being reviewed by the IT unit of our department or any other related unit, so that we make sure that it complies with existing policies like the privacy law. Is it also compliant with other standards that are already existing within the ministry or department? And also we make sure that it's also interoperable with IT, so that the information that it collects will be efficient. We do not want duplication and redundancy. We also have other minor considerations like uniqueness, magnitude of the problem, data ownership, etc. But they usually have workarounds. So the three considerations I previously said are the most major ones.
So Donna, this raises a really interesting point. You know, one of the things that, as you were speaking, that came to my mind was, how has COVID-19 changed things for the National TB Program? So I think based on what I'm hearing from what you just said, you know, even when it comes to solutions and particularly digital health technologies, it sounds like, you know, the National TB Program of Philippines, but maybe, you know, at a larger scale, the Department of Health of Philippines, essentially, it sounds like you want solutions and particularly digital health technologies that have multi-disease applicability for TB, for COVID-19, for both communicable and non-communicable diseases. And so, I mean, tell me if I'm not hearing you correctly, but that's what I'm hearing, and it would be great to get your thoughts on that.
Yes, you're correct. By prioritizing solutions that are applicable for several programs, it mainly affects cost. So the effect is not only used by TB, but also by other health programs. And also that would also ensure sustainability, because it would mean that the funds for the solution will not only cover funds from TB, but also other health programs. And then in the field, the multiple health workers would be able to use it, not just the TB clinic.
No, that's fantastic. Another big topic for us to revisit, and I wish we had more time, and I apologize in advance if the Q&A session might either be shorter or run a little bit later. But, you know, for now, let's move on to our third question. And thank you so much, Donna. I have a feeling a lot of people will have a lot of questions for you in the Q&A session. The third question is, Kelowna. You were one of the very first innovators to become aware of the STOP-TB Partnership's Accelerator for Impact platform, and was one of our early champions, which means a lot to me personally. But you know, putting that aside, can you tell us from your experience as the CEO of Anthem Biotech and as an innovator from, you know, TB affected countries, South Africa, what has been your like number 1, 2, 3 barrier and challenge to introduce and scale up solutions your company have developed?
Great. So thank you very much, Jackie. Thanks so much for having us here, and wonderful to be hosted, Luchika, by the STOP-TB Partnership this afternoon. So really, I mean, we've kind of been at this for many years, and really our niche area is in extrapulmonary TB. And we've developed diagnostic tests for extrapulmonary TB, lab-based at this point in time, moving into point of care. But really, the digital health space is where you really want to move into, so that we can address these patient care needs that Marianne, Maureen, and Donna have spoken about. But really, on the ground, if one has to look at a small organization within a country that has got a very, very high caseload on TB, one of the biggest challenges for us is actually on diagnostic development and dissemination. The rollout, the regulatory aspects of it, the lack of funding for healthcare solutions that are on the continent, particularly on Africa, is so sparse. And there's a lack of social impact funding on SMEs. And I think, you know, and those from developing countries, I think that that's a very, very big thing for us, because I think many of the countries really have the knowledge of what needs to be done on TB. They have the research that is being done. They have so much. It is the translation of that knowledge into a patient-centered solution that is the critical component. It's taking that leap from one end through to the next that is absolutely crucial for us to be able to make an impact and even dent the TB caseload globally. So I think, you know, the conversations around, you know, current diagnostic methodologies on lab-based tests, those are the big issues, and we really need the support systems to be able to break those barriers. For me, when I think about digital health technology solutions on TB, you know, we looked at one of our earlier models, probably about 6 or 7 years ago, was around treatment adherence. And we developed a very simple, straightforward model around, you know, an SMS that would go through, a photo that would be taken around the whole DOTS program, right? And that was a very simplistic solution. And I almost think even though we've, you know, 5 years later, the mobile telephony has rolled out so enormously across the continent, we still struggle with data. So when we look at digital technology solutions, particularly around patients, I think the very, very important thing to remember is the accessibility and high cost of data. We're seeing it across the educational sector. We're seeing it across the healthcare sector. Those are really, really important. Platform integration is another massive issue. Integrating across, you know, the various applications. So many people are coming up with solutions, but how do we integrate that? How do we integrate that with what Donna had spoken about? How do countries actually look at, you know, integrating that with their algorithms, integrating that with the data security, the countries, the laws within the country. So I think those are really, really important things on integration that one needs to understand. But also, you know, I mean, someone said to me once, I read somewhere that, you know, kind of engineers are from Venus and healthcare workers are from Mars, right? And patients are not even considered in the same solar system. So like they're almost like these parties in a dysfunctional relationship, and the three of them talk right past each other. And there's not enough of involvement of patients and doctors in the early stages of product development. And this really results into, you know, kind of copy-paste situations of Me Too products or failed products that really don't solve the big enough pain point for this very large market. And I think that's very, very, very important. I mean, you know, on these app developments, you've got so many people developing apps, but have they considered the simple fact that mobile phones and or the communities that they are serving cannot actually afford high volume apps on their phones, right? Or high database, right? So, you know, it's trying to keep things, and you know, it goes back to the situation where sometimes the solutions need to be kept stupid and simple, right? While addressing the entire accessibility through to patient care. So there's many fancy solutions that can be deployed, and we've seen COVID has actually highlighted and really, for me, has crafted such a magical pathway for TB in terms of speed of diagnostic development, speed of treatment methods, application technologies for adherence, right? Really, those are the big things for us, right? Diagnostic development. I mean, we look at vaccines, right? And we've been able to do that within a space of 12 months. We've been looking at this, I mean, there was a vaccine approval in about 5 years ago, or 3 years ago, I think, 2018. It hasn't even entered phase 3 trials yet. So I think there's so many other issues that we need to look at. I think the regulatory environment is another thing for us to actually understand. There's so many of these guidance documents around medical applications, but on digital health, are they crystal clear? Are they well defined, right? And those are the things, like, Donna had said, they had to, relook at those technologies within the country. So that's also a very important aspect. And again,
sorry, please, sorry. Apologies for interrupting. I'm so rude.
No. I mean, at the end of the day, about all of the, on diagnostic technologies is who is going to pay, right? Same thing on the digital health technologies. Who is the payer, right?
I think what I find really interesting, Kelowna, is, I think there's this, and I mean, maybe the assumption is right. What I found really fascinating is there are TB affected countries who have the innovation ecosystem to develop the appropriate technologies, not only for their national burden, but also a burden that really affects the world. But there's this kind of like default assumption that, I don't know how to best put it, but the innovators from the TB affected countries have a higher barrier to entry point than maybe the innovators coming from the US or from Western Europe, et cetera. And there's just like this inherent kind of bias or assumption, not to diminish the solutions that are coming from these countries, but, like I think about South Africa and India, Indonesia, and even Philippines. I mean, Botswana, et cetera. Like, I mean, there's a strong innovation ecosystem there with a lot of like really smart entrepreneurs and innovators who are developing health solutions. And I'm just wondering what the TB and global health community at large can do to support them even further. Not that everything has to be a zero-sum game, because of course, like the US and the UK and France and whatever, like are developing really great solutions too. But what can we do to support innovators coming from the TB affected countries that know what the problem is, know what the burden is? And further support them. And I apologize, I'm going to have to probably ask you to answer that question maybe a minute.
No, absolutely. So I think, in some cases, Europe and or the Western countries really have the investment levels to drive these. We have a number of issues. We have a skills shortage. We have an infrastructure shortage. So laboratory spaces in order to do this. We have people that understand TB completely, but the translation of that knowledge into something that is going to have an impact still continues to be a problem. So that's one aspect. I think the other aspect is having some sort of unified regulatory system, right? That would make a huge difference. Also, the other thing is a trust issue. Is that, one needs to trust that the knowledge and experience that's coming from these environments comes from hands-on expertise, because we end up trialing, technologies from every part of the world, right? They all come for their trials into our countries, right? Into high burden countries. Yet, when a technology comes out of this country or comes out of any one of these countries, there's somehow a seed of doubt on, its validity, its efficacy. You end up, having to climb 10 more hurdles than anyone else would have. And also, yes, quite rightly so, some of these regulatory aspects that we need to understand, we don't yet. So, those are like kind of knowledge gaps that need to be filled.
No, that's fantastic. Again, I wish we, I think we have to have a whole conference around the topics we're talking about, but this was like really eye-opening for me too, because the Softy partnership is and Luchika and Sahu might I can't speak for them, but maybe I can. I mean, the people who can come up with the appropriate solutions for problems are the people who are actually dealing with the problems. And the more we can do to support the innovators coming from the TB affected countries, I think that goes to the heart of the sustainability issue or question. But, that's just my personal opinion. So I won't speak for the organization. But with that said, maybe I will move on to our fourth question, because I know we are really,
Thank you, Jackie.
It's an hour and a half of EIS. But for those who can stay longer, please do so. But Karen, the fabulous Karen, are you online?
Yes, I am.
Oh, okay, fantastic. Okay, so, Karen, Health Through Walls, and I really learned about Health Through Walls and you through Kelly and Sherd here, has been doing some great work in Haiti, particularly with video observed therapy to address the TB burden within the prison communities. And interestingly, it sounds like the country is quite keen on demonstrating an open source, national interconnected care platform. Can you tell us, as an implementing partner, which is, I think, brings a very interesting perspective, can you tell us why this is important and why this is important for Haiti?
Good afternoon and good morning, everyone. And I guess I'm humbled to be among those beautiful ladies today. And thank you, Jackie, for having me. I think I'm going to start with why it is very important for us to connect together. COVID-19 has changed everything. Everything has changed, and I think we need to change our mindset also. And the way we provide healthcare has changed. And this is not just Haiti, it's the whole world. So I think now we need to evaluate the needs. And maybe we can use TB as an entry point, transforming primary care. Because I'm thinking we can bring the care close and as close as possible to affected community. So I think this is one of the main important reasons I think we need to connect together, because like I said, COVID has changed and everything has changed, and we need to work together ourselves to see how we're going to bring the change. And that's how it's important to connect. And by connecting together with all those topics, I think we need to evaluate the needs of each group related to TB care and primary care. That's one of the things we need to do the evaluation. And I think we might need to identify the barriers and the context of why I guess we need to make a difference now with the innovative ideas. Mm-hmm. And we need to know what is the problem, see where we can find the funds and resources, to start it again. And we can try to use lesson learned from different programs that we had before and design a care models, because some of the programs that work in different countries, and especially is based on culture and how it works. And I think as a team, we need to sit down and see how we can create a models. We can coordinate with everybody that is involved, all the stakeholders. And one of the main group we need to work with in each country is the National TB Program. That will be one of the top for us to work in. Us in Haiti, we have a good relationship, which us introduced the video that in the prison, and that has helped us a lot, especially during those COVID, and that had assisted us a lot. Also, I think together we need to design a care model base for each country, what we experience, the culture, the patient needs, and what needs to be done. As Luchika mentioned before at the beginning, we cannot continue doing the same thing and expect a difference. So I think as a team, as a global health, we need to stick together, I guess, maybe more meetings, more coffee talk, and how we're gonna be able to do something innovative together as a global health.
So Karen, I have a potentially controversial question to ask you. The one thing I worry about, which I've started to worry about a lot more, and it's because I've like disconnected myself from anything related to Facebook. I am no longer on Instagram, Facebook, WhatsApp, whatever. And the reason why that has become such a big deal to me, and I actually had a conversation last night with my husband about this, is I am really worried about the data that is collected from all these different types of solutions, including the interconnected like care platform. And the reason why I'm worried is, the TB affected community and people have to deal with so much shit, for the lack of a better word. And I guess I'm like wondering from you, particularly because you also work in Haiti and within the prison communities, what can we do as a community to protect and ensure that the data that is being collected from these solutions, including this interconnected care platform, is safeguarded, and we do right by those, who are affected by this, disease. Like, it would be great to hear your thoughts on this, because I think the data component of all these different types of solutions, bringing them together into this kind of like interconnected care platform is like the one thing that really worries me. Maybe I'm being overly like paranoid, but it would be really great to hear your thoughts on that.
I think you're right. Paranoia is not the way, because myself, that's one of our concerns in Haiti with the data. And then I think one of the things we must do, or maybe I think we need to try to use a platform that is trusted by maybe the National TB program, that international wise, I think. And there's some dashboard that we make sure that we are using, and that's gonna assist us of keeping or getting good information. And that platform, like I said, we might have to internationally approve it, because sometimes this is one of the main issue, I guess, us in Haiti we having, or the numbers right. Is that the right numbers? And then the follow-up. So I think definitely that's something we need to have in our plan.
No, fantastic. So again, oh my gosh, so many amazing things that were discussed, and more topics we need to really just kind of like dive into. But in the interest of time, thank you so much, Karen, and on all of our VVVIP guest speakers, as Koreans love to say, because in every Korean drama, there's like a triple VIP person. All of our dramas for some reason. But okay, now moving on to the second fun part of this virtual innovation spotlight. Can anyone guess which movie this line is from? Can you please put this in your chat box before we go to a very brief Q&A session and close out? Okay. Lonnie, yes. So, Ferris Bueller was one of my favorite movies, but I think Eurovision Song Contest, The Story of Fire Saga now is, so that's a whole nother story. But, for 5 minutes, I just want to open up the floor to everyone. I know when you do this, it can get chaotic. We're running over time, and I apologize for that. It's my fault. It is what it is. Please raise your hand if you have any comments, questions, or thoughts about everything that's been discussed so far, or just like jump in. Don't be shy, really. So for 5 to 10 minutes, for those who can stay, let's just kind of open up the floor. No questions?
I can say something.
Oh yes, Luchika.
Yeah, so this was not absolutely for me to say something, but I know that if nobody, because I found this conversation absolutely fascinating, because I think the topics that we reached here are very actual, very real. And I think you, Jackie, said that maybe this deserves a bigger platform for discussion. And I feel like even creating a movement like Women We Know Better, because you know what I mean? Like the points of the ones that are, the people that go through the problem will know better. The developers in the developing countries or the high burden countries, let's put it this way, they will know it better. But as you rightly say, historically, there was this overwhelming feeling that, no, if it's developed in, let's take even my own country, I'm saying even because it's sort of EU, but even, you know, people are looking, oh, this is a Romanian product. I'm better looking at another one, you know what I mean? Or when you come with a solution. So it's happening everywhere. And as I think you already just said, there are even more hoops for the local developers than for the international ones. That's one aspect. And the other is the demand part. So we looked here at the creating part. We looked here at the final users in terms of the people that are using the tools, being affected and being like the TB program managers and so on. So I think this was an amazing discussion. I really would like to take this at a bigger scale, because then we need to not only share this further, but also embrace and construct around it and to make the voice heard. From Stop TB, you know, we have this decision that we made that we will fund solely as much as possible, but we really implement that, organizations, groups, developers, whatever call it, from high burden countries. We are not going to fund any more groups, networks, or stuff like that comes from developed world or not put developed world, because I don't know the terminology is not the right one, but the non-high burden countries, let's say. So, you know, we don't go to have to fund something from for a better case Australia, when we can have solutions in South Africa, or we can have better things in Rwanda or Kazakhstan or, you know, Ukraine or whatever, you know. You got my point. So I just wanted to say that there were a lot of points here. This deserves a larger platform in such a way that we create a movement centered on TB women and the discussions that we are having here. Yeah.
No, I completely agree with you. I mean, there's so much that has happened in the past 33 minutes. I don't even know where to start, but you know, just to rest assured that Stop TB Partnership and our team will take this forward, because I think unless we hear, not just listen, but hear and implement like what we have just heard. I mean, I don't know how we end any disease, not just TB, but any disease. And so I'm so grateful for all of our VVVIP speakers and everyone who joined today. But with that said, I want to give anyone a final opportunity to say something. Okay, so then I just want to move on to some final words. Olive unfortunately had to leave for a TB Reach meeting, which is just as important as my VIS. But I just want to show everyone what an exciting lineup we have in the coming weeks. So if you're not on our mailing list, please shoot us an email at easy@stoptb.org. But to be honest, the easiest way, and no pun intended, to learn about all of Stop TB's events and everything we're doing is by following us on Twitter. So please follow us on Twitter. So with that said, thank you very much to everyone for joining our VIS today. And I'm going to